In 2003, the world faced stark warnings of a deadly global pandemic. In Asia, avian influenza or bird flu was spreading to humans. Experts warned that billions of people around the world were at risk. Tamiflu emerged as the leading antiviral medicine. But this new report claims the drug's benefits were exaggerated.
There's no reduction in important complications, that's pneumonia and hospitalisation. It also tells us that there's no effects on transmission of flu that would be credible to use in a pandemic situation.
The fear of a pandemic led to this: warehouses full of drugs stockpiled for an emergency. The British government spent $793 million on Tamiflu. The US government a staggering $1.3 billion on the drug. Now, the new report found Tamiflu worked, but only a bit. Flu symptoms, which would otherwise have lasted 7 days, were reduced to 6.3 days for adults and 5.8 days in children. Gains so marginal that the report's authors say over-the-counter drugs would have had the same effect. The report's authors battled for more than 4 years to get access to the raw research data on Tamiflu, and their findings not only questioned the drug, but also criticised the system, the way drugs regulators are only ever presented with selective data by the pharmaceutical industry.
They have an irreducible conflict of interest. They perform the studies, they provide the regulator with what the regulator asks for, but they do not go out of their way to present the benefits in a reasonable fashion or to give us a clear evidence on the harms.
Tamiflu is manufactured by the company Roche. It is disputing the report's conclusions and the allegation of secretiveness.
We shared all of those things with the regulators, and they reflected it accordingly in the label. So I think, I feel that we've been as transparent as was suitable at the time under the regulatory environment that there is.
But the debate has not yet affected Tamiflu's status. For the moment, the World Health Organization still classes it as an essential medicine. Paul Brennan, Al Jazeera.
Sri Lanka has cut rabies deaths by more than 90% in the past 40 years. Health experts say an anti-rabies campaign and increased awareness has helped to fight the disease. Minelle Fernandez reports.
Reaching out to the community. Mobile units travel throughout Sri Lanka to vaccinate domestic and stray dogs against the rabies virus. Dogs are the main carriers of the disease and the main target of a successful anti-rabies campaign, which has seen fatalities from the virus fall from 377 a year to just 28 in the past 40 years.
Unvaccinated dogs are there. They will catch the disease and transmit to the people. So the sterilization or birth control program will prevent this.
Last year, health authorities vaccinated almost 1.5 million dogs and sterilized a further 200,000 animals. For dog owners like Chandima Damayanti, prevention is the best option.
Dogs are animals. They don't understand. If a person is bitten and the dog has rabies, the person can die. That's why I thought I should vaccinate my dogs.
The animals themselves aren't always cooperative. Vaccination programs like this one in a village outside Colombo are a key part of the government's fight against the disease. They have proved a more effective and cheaper way of dealing with rabies, which can kill victims if left untreated. The government provides free vaccines and treatment to bite victims in clinics like this, at a cost last year of around $4 million. Dr. Kanagaratnam Ilango, who heads the rabies treatment unit at a busy Colombo hospital, says knowing how dangerous the disease is helps.
The people aware that if they are infected with the virus, that is the end of their life. So they come very quickly. Even with the safest animal, they come very quickly to get treatment.
Domestic pets are responsible for the majority of bites inflicted on humans, so annual vaccines are essential, especially if Sri Lanka is to reach its goal of eradicating rabies by 2020. Minelle Fernandez, Al Jazeera, Wadduwa, Sri Lanka.